Okay, first of all, folks, we've been working with addictions for the last 20 years. Last year, we developed a treatment protocol for opiates, and it was vetted by the military. Julio Gonzalez, who's in charge of 26 addiction centers and chemical dependency centers with the military on the South Coast, he evaluated the program that we developed. So our goal is to do a customized addiction program here in Orlando that focuses on alcohol, opiates, and even eating disorders. So, what we have to think about is a lot of the treatments for opiates just treat the head and it doesn't treat the body.
What is an opiate?
An opiate is a morphine derivative that I think it was developed in the 1950s. I'm not sure of the pharmaceutical company, but when people are in pain, they need pain medication, and opiates are what's used. Back in the day, we had no idea that they were so addictive. So as pain management physicians started utilizing opiates, and obviously the drug trade, we started seeing what it was doing to the metabolism over time. I've been working with opiate patients since I've been a paramedic, and then what I've done now is I evolved to doing advanced testing for opiate patients that's not being done in any of the addiction centers. And I've actually been to the addiction centers and talked to the addiction specialist folks, and there's a lot of information that's not getting out there, and there's a lot of information that's confusing, obviously, with the marijuana, that people don't understand, the benefits. Everything that I'm going to be talking about is on the Russ Scala YouTube channel.
Yes.
So you could get into longer videos on the opiate addiction, and you could go to my YouTube channel and watch it. But addictions, as you know, there's no sweeping generalizations. People get addicted to alcohol, simple carbohydrates, and opiates for a variety of reasons. Just look in the New York Times 2 days, I think it was 3 days ago, they had psychedelics are going to, LSD, low dose LSD is going to be a new treatment protocol for mental disorders. Now think about that. We've known for years that, Dr. Abraham Hoffa, who was using low-dose LSD in Saskatchewan hospitals, was curing alcoholism. So now, because Timothy Leary gave LSD a bad name, now they're using it for PTSD. They're using psilocybin for mushrooms to take care of our troops. There's a lot of change going on, and the same thing with marijuana. Folks, we have CB1 and CB2 receptor sites on our central nervous system. Our metabolism produces a natural cannabinoid. Why do we have those receptor sites on our central nervous system? So people along the way have used marijuana to help with their addiction, to calm themselves down, to shut off the chatter in their head, because years ago when we didn't have fMRIs or advanced imaging, they understood that something was making them feel better, and it was the marijuana attaching to those CB1 and CB2 cannabinoid receptor sites. We didn't know that a few years ago. Well, here's something that's interesting. Dr. Peter Bregan wrote a book called Toxic Psychiatry. You can look it up, folks. He basically does research. He was a psychiatrist for, I think, 30 years. He talks about how SSRIs, Prozac, Paxil, and Zoloft, damage the prefrontal cortex over time. So here's a drug that's prescribed every day. We know damages the prefrontal cortex, but that doesn't happen with marijuana.
Right.
So, again, do your research, folks. Drill down on this. There's something called opiate-induced neuroplasticity. And what that means is you're not going to turn an addiction around in 12 months. Because if you think about the tree branches growing into the ground, that's a visual for what happens to our brain. When somebody's addicted to opiates, they actually grow new brain tissue that hardwires that addiction. It's called opiate-induced neuroplasticity. That, combined with the opiate bowel, how the intestinal tract is the second brain and impacts the brain chemistry. To fix somebody, to help somebody that's on opiates, you got to look at their intestinal tract, you've got to look at their brain chemistry, you've got to look at their thyroid function, because all of that is suppressed when they're taking opiates. So talk therapy, we could do better. Yeah, folks, think about it. Way back in the day when I was a paramedic, I used to deliver medication through a respirator where people would actually inhale it. So when you inhale a marijuana and the cannabinoids hit the CB1 and CB2 receptor site, the lungs disperse, this medication or the marijuana in this sense across. If you were to lay your lungs out, they would cover a tennis court. So that's a great way to deliver medication. Another thing I wanted to say, folks, if you go to the Russ Scala YouTube channel and look at the addiction program, Julio Gonzalez, who was in charge of 26 chemical dependency centers, just listen to what he says. We developed something that's never been done before. So the information that I'm sharing with you and Ted today has never been in anybody's hands yet. So this is why I want Orlando to be ground zero I want to open source this information so every addiction center, every mom or dad that has a son or a daughter that was addicted to an opiate, they could apply these principles.
Right.
It's not just handing out Narcan. It's not just handing out antidepressants. We could drill down and go deeper and turn this around. I'm in the medical innovation business, so you know I've had more doors slammed in my face than a Jehovah's Witness. You could get it, but I still keep moving forward. I still partner with innovative people, and we could do a lot with this opiate thing. We could do a lot with the marijuana thing as well. The marijuana is going to be very important for people with disease. Again, why? Because we got CB1 and CB2 receptor sites on our central nervous system, on our brain, okay, on our spinal cord. Why is that? Also, we've got CB1 and CB2 receptor sites on other organs in our body. We could, you know, somebody that's going through chemotherapy that's, you know, in severe pain, if we could take that pain away from them, what's the stretch?
Directed.
Exactly. Well, I think the pharmaceutical companies, we always blame big pharma. They're a business. They got to stay functioning. They got to come out with new drugs. But big pharma, you know, because of their competitive environment, they're coming out with marijuana pills, right? Or they've had marijuana pills for a while. They also have, you know, this is really neat. They knew that essential fatty acids from fish oil could thin the blood. So instead of giving somebody a blood thinner, they came out with a new prescription that doctors can write this prescription called Lovaza, and all it is an omega-3 fatty acid. And they said it's very pure. So now the doctor can write you a prescription for Lovaza, which is really an omega-3 fatty acid. That's a long way of saying Big Pharma may get on board with this nutrition and this marijuana. Why? Because it takes them billions of dollars to design one drug.
Absolutely.
So I think the competitive environment may be a win-win for us.
I like it.
You know, right?
Any parting words of wisdom for them? Anything you want to leave them before we head out for this week?
Okay, folks, here's what I want you to think about. And this is going to be kind of scary because you're not going to hear this from your doctor.
Uh-oh.
Diabetes, heart disease, cancer, and dementia all have a couple of things in common, and all those treatment protocols are changing in real time. What are the two things that all the big four have in common? Is inflammation, okay, and high insulin levels. If you look down at your food tonight on what you're eating, if you're eating the ketogenic diet, if you're doing intermittent fasting, you will keep your insulin levels down. Again, I'm not trying to be the food Nazi at all, but think about keeping your insulin levels down. You impact all four of those disease states.
Right.